Good afternoon, everybody. Our last briefing was on Friday, July 24th. Since then, we've announced one additional death related to COVID-19, which brings us to a total of 64 deaths. And I do want to express my sincere condolences to the family and loved ones of the deceased. That individual is a female in her 60s with underlying medical conditions, and she lived in the NSHA Eastern Zone area. She was not a resident of a long-term care home. Her case of COVID-19 was previously reported as being resolved. However, she did pass away in May, and the death has been under investigation since then, and just recently it has now been determined that COVID-19 was a factor in her death. So the numbers, our online numbers, have been updated to reflect that death. And so moving on, today, as the Premier said, we have 2 new cases of COVID-19. These individuals traveled together outside of Canada. They are in Central Zone. Unfortunately, that they have, as soon as they returned to Nova Scotia, they began the self-isolation protocol. So for those following the numbers, we've had in total 1,069 cases of COVID-19 in Nova Scotia. 63,647 Nova Scotians have been tested with negative results, and we've had now 64 deaths. Fortunately, we remain having no licensed long-term care homes with active cases of COVID-19. And yesterday, the QE2 Health Sciences Center Microbiology Lab completed 456 tests. Today, our mandatory mask policy is in effect for indoor public places, and we've had the policy in place for public transportation and transit for a week now. Our approach around masking is based on 3 key areas: the policy itself, our communication around that policy, and ensuring people have access to masks. So let me talk about each of those 3 areas. Many people are wondering why we're doing this now when we have no active cases of COVID-19, and I'm getting lots of questions. Why didn't we do it in March when our first cases arrived, or later in the spring when we had our peak? It's simply the fact that our position has changed because the evidence on both the virus that causes COVID-19 as well as the effectiveness of the use of masks by the general public has evolved. We now have evidence and expert recommendations that the general wearing of masks is effective in reducing the transmission of the SARS-CoV-2 virus. So adapting our approach as evidence evolves should be seen as a positive rather than that we were wrong at some point in the past. The reason that it's important to make masks mandatory now, even with few active cases, is part of being prepared for the likely occurrence of a second wave. It's not about the epidemiology today, it's about what's likely coming. We've all seen what's happening around the world, and there likely will be at least a second wave and maybe more. So living with COVID is part of our new reality. Changing behavior around things like masking takes time, so we need to start making masks a habit now. We've done a good job of forming habits around hand hygiene, cough etiquette, physical distancing, and staying home when we're not feeling well. So we need to now add masks in indoor places to that package of public health measures, and we need to stick to all of these measures together for the foreseeable future. That's what's going to keep us and our loved ones safe. It's what will allow us to keep our communities, our society, and our economy as open as possible if and when we get a return of COVID-19. Everyone knows how important masks are. We need everybody to know how important masks are, so the communication around this is critical. We've put mask information and resources on our website. We have things that are on there. We have a sign for businesses that can they download that and post that in all their entrances. We've got information on how to wear a mask properly, how to choose, know what a good mask is, and how to even make an effective homemade mask. So if you go to our coronavirus website now, we now have a mask section on the very front page that you can click on to take you to all that information. We're also sharing all this information through all the channels that are available to us for communication. Our website, all our social media work, advertising, all our updates to various stakeholders. I was on 2 large webinars with stakeholders earlier this week, as well as answering any individual questions that come into government. We're asking members of the media like yourselves, businesses, workplaces, and industry associations, as well as individual Nova Scotians and their own use of social media that can help spread this message as well. For an example, we have now created a common sign that we've sent out a PDF to that sign, and we're asking all businesses and anybody who operates a public space, ideally we'd have that sign on every entrance into a public space, and the common signage will be an important and frequent reminder to Nova Scotians. It's also important that as Nova Scotians become aware of the mask requirement, that they have ready access to masks for themselves and their families. Most of us will be able to buy masks. Many of us have already done so. There are certainly many small businesses in Nova Scotia that are now making them. So it is an opportunity for people to follow the theme of buy local when we're looking for masks. As I said earlier, our website also has a link to information from the Public Health Agency of Canada about how you can make an effective homemade mask on your own. But it's important that, as I said, that all Nova Scotians have ready access to masks. That's why we've taken some steps ourselves as government to support that. So we have, as was announced yesterday, we're now providing all our provincial libraries and the 24 provincial museums that are open with some masks, and that's a point of access to people who, whether because they can't afford it or have some other reason they can't get a mask, they can go to their local library or provincial museum and request a mask for themselves and their family. We've given supplies of masks to transit and to taxis. We've distributed them to places such as our homeless shelters. We have supplies of masks at our access centers at another place where people can get them. And when we open schools, we'll have a supply of masks there as well. And in addition to that, we have an email address that small businesses who need help getting a supply of masks, they can send an email in, they'd be made aware of that, and they can get a supply of masks as well. So we've done many, many things in government to make sure that we are supporting ready access to masks. These are all reusable non-medical masks, and so we're not going to be supplying these masks indefinitely, but this distribution is an important initial effort to make sure that, that access to a mask is not a reason for any Nova Scotian to not be wearing a mask. I know there's been many questions coming up around masks. It takes people time to get used to them, so I'm just going to cover a few of the key and common questions that have been coming up. First and foremost, I want Nova Scotians to use this as a general rule of thumb, that when in doubt, wear a mask. If you're not sure, always err on the side of caution. If you're in an indoor place and you're not sure, we ask everybody to always have a mask with them, and if you're not sure, do the right thing, be safe, and put on a mask. So we need to now get in the habit, along with our wallet, our purse, our car keys, always have a mask, whether it's keeping one in the car or at the door, wherever you keep those other things that you take every time you go outside of the house. We've adopted hand washing, physical distancing, and limiting our social contacts, and now we need to adopt the carrying of masks and wearing them where appropriate and necessary as part of our daily lives. Some people are wondering if it's safe to wear a mask for long periods, and the short answer to that is absolutely safe. However, if you're wearing a mask for a long period of time and it becomes wet or soiled, then you need to change a mask. But when you think about it, there are many healthcare professionals who wear masks for long periods of time every day they're at work, and sometimes their days can be very long. So prolonged wearing a mask is not a safety issue. If you're wondering if you need to wear a mask at your work, ask your employer. Masks are required in many workplaces under the public health order, but even if they're not, if your workplace is not defined as an indoor public place, your employer may well have a mask policy as well. Some people are wondering if they need proof that they have a medical condition that would prevent them from wearing a mask, and we are not asking for proof. We are not setting up a system. Nobody would be required to go get a medical certificate. We're not going to put that burden on our healthcare system. So we're asking employers and businesses to take people at their word. There might be some people who take advantage of that, but I believe that most Nova Scotians are prepared to do the right thing and to wear a mask if they can, and will be honest about whether they need to wear a mask or they're able to wear a mask or not. Some people are also wondering about what exactly is an indoor public place versus a private business space. Indoor public places can be both private or publicly owned, but they're places where the public is fully expected to be and has ready access to. So anywhere where members of the public can go without needing to have a membership, without needing to have a security pass or anything like that, where the public has ready access, whether it's owned publicly or privately, that's considered an indoor public place. So, for example, the public has free access to the lobby, elevators, and hallways of many office buildings. So those are public places. But they don't have free access to the actual office space of that business. So those are considered private. If you think of retail spaces, so take, for instance, a clothing store, where you're in the shopping area, that's a public space, but the public doesn't have access to the back rooms, the supply rooms, etc. So those are not covered by the order. The same as we've got a lot of questions about a car, for instance, around a car dealership. So if you're in the showroom or the waiting area at a car dealership, that's a public place. But the service bays or the back offices are not a public place, and so any workplace policies would apply for those. The mask requirement applies to spaces that the public has ready access to and not private spaces, as I've said. But we are encouraging business owners and employers, they can set their own policies for private spaces, and we would encourage them to also use mask use in their common spaces. So I've used the example of my department. We've gone beyond the public health order, and even in what are so-called the private spaces of the Department of Health and Wellness, we now have any staff and visitors in our common spaces in that office we now have a policy of wearing masks. I just want to clarify, because it's come up as questions, that for rented meeting rooms or halls or other similar places that hold events or gatherings, they are considered public places. But we have created an exception for private business meetings of up to 50 people. So if you're having a private business meeting, you're going to a hotel meeting room. If you're 50 people or less, we're considering that a private space. But if you're hosting a big wedding reception or something in that same hotel, and your that you are part of are classified as a gathering under the public health order, and mask wearing would be required. Yesterday, the Council of Nova Scotia University Presidents issued a statement requiring everyone arriving on campus to have a mask, and each institution is going to set policies that will detail where and when masks need to be used on their own campuses. I really would like to applaud and thank Concept, as well as all the other employers who are taking steps to keep their employees and the surrounding community safe through masking policies. Many businesses have invested in plexiglass barriers for their employees, but plexiglass does not replace the need for masks, because the virus that can be carried in the air can go around, over top, underneath the sides of plexiglass. So again, plexiglass does not replace the need for masking. However, an investment in plexiglass has not been wasted, because the plexiglass adds an additional layer of protection, and especially when people are directly face-to-face and there's direct breathing or somebody's coughing or sneezing, the plexiglass adds that extra layer of protection, but again, it does not replace the need for masking. The same is with face shields. Many businesses have given employers face shields to wear. The face shield cannot be worn instead of a non-medical mask. It can be certainly supplement a mask, but a face shield or eye protection protects the eyes of the wearer. It doesn't stop virus getting out of their nose and mouth like a mask does. So just like plexiglass, if people want to wear a face shield or some eye protection in addition to a mask, that they can certainly do that, but a face shield or eye protection does not replace the need for a mask. I've also, it was brought to my attention yesterday that there's a company out there with they've created a clear plastic mask that's being marketed. They're saying it lets you show your smile. Unfortunately, when you look at it, it's really like a face shield. It doesn't fit tightly around the nose and the mouth, so it's not an acceptable mask because a virus could easily get out and escape around the edges. So it's important that people have information on what an acceptable mask is, and we have that on our website. And if you're worried about your smile, that when you wear a proper mask, people will still be able to see the smile through your eyes. Many people are also wondering about how masks can be mandatory if we're not going to enforce this. We do have the ability to issue fines for anybody who's not following any of the orders under the Public Health Act, and that's stated in the Health Protection Act. But we're not going to be taking a heavy-handed approach. We also need to make sure that people with valid medical reasons to not wear a mask have equal access to public spaces. I have the confidence that the vast majority of Nova Scotians will understand the need to continue to protecting each other, especially those who may be more vulnerable, simply by being the kind, caring, and compassionate people that the world knows us to be. I believe in the goodness of people, and I'm confident that most Nova Scotians will do the right thing, look after each other, and wear a mask.